Doug Eastman from Kaiser Permanente in the United States. Thanks for joining us on ehealthspace.org.
Thank you.
You have an interesting technology title, a very long one actually, so I was going to get you to explain what it is you do at Kaiser.
Sure. Well, my title is Executive Director of Technology Adoption and Organizational Capability. And what that really means is I focus on the people side of the business. When we launch large-scale, enterprise-wide technology, I make sure, it's adopted, people are embracing the technology, they're using it to get the return on investment.
Okay. Now the key message that you brought to this conference, we're at the Healthy Nation conference today, is that technology is not the big story, but the patients are, and I think that's obviously something that resonates very well with clinicians. But it strikes me that it's also the case that clinicians also need to get excited about technology itself. So how can we kind of get this balance between the needs of the patient and the needs of the clinicians?
Sure, well that's a good question. I think a lot of times if you don't get the buy-in of the clinicians, the system's not going to work because they're not going to use it to its full benefits. So understanding what their work life is about, making sure that they're able to better deliver care. The nice thing about this kind of technology is that it takes the information and it presents itself in actionable ways where you can better know more information about your patients. And I think patients appreciate that too, because when they go and see their clinician, they want to know that the clinician knows everything about them and fully understands their scenario, even if it's been a year since they've seen the doctor.
Okay. Well, we should actually just at that point also talk about the success you've had. What are you doing in Kaiser that addresses some of these issues?
Yeah, well currently we're done implementing at Kaiser with the ambulatory and the inpatient suites. So the bulk of my work focuses on optimization and benefits realization. And what that really means is it's everything after go live. So making sure that people are using the system efficiently, not just getting through their days. Looking at physician work-life balance, because there's a lot of work to do in the system. Documentation, they still have to have good access for patients to see them. So they work full days, and what we try and do is make them as efficient as possible so they can get home and see their families as well.